Removal of breast implants is a really interesting topic. In fact, it's one of my pet topics. When should they be removed? Lots of situations where a patient might choose to have them removed. I think the most common one is patients just want them removed because they no longer need them. So maybe they had implants when they were younger, and then life has changed and they no longer feel that they want them anymore, and this asks them for them to be removed. So that's not an unusual scenario, but frequently patients will want implants removed, or they should be removed when there's a concern. So for example, there might be an infection, which again is very rare, and if it does occurs only in the sort of first few months. If an implant has ruptured, then you may consider having it removed, although that's not something that needs to be done as an emergency. If there's a concern about ALCL, so it's lymphoma of the breast, then an implant needs to be removed together with all the capsule so that it can be sent off for analysis. When an implant has become capsulated, when there's significant scarring around an implant, patients may then choose to have the implant removed, sometimes exchanged, to deal with that, because it can be quite uncomfortable. And then increasingly in my practice, I see a lot of patients who are worried about breast implant illness. This is not a recognized medical condition, but there are lots of people around who have had implants who develop a variety of symptoms, ranging from new allergies, hair loss, feeling fatigued, joint pain, and all the traditional blood tests and investigations don't show anything. And then when they have their implants removed, they feel much better. Now, we don't know whether that's a true effect or whether it's a placebo, but certainly if they've reached that point, they want their implants removed, it's not an unreasonable thing to do. And so sometimes we'll do that for breast implant illness. Any operation has risks, but yes, it's a safe procedure. And in my practice, I will tend to do this as a day case operation. I don't use drains. It typically takes about an hour, even with an en bloc capsulectomy. There is a specific bra that I ask them to wear, which helps sort of to mold the residual breast tissue back into shape. But overall, I think it's a very safe procedure as long as the patient understands the risks and limitations. A capsulectomy is needed if there is a notable capsule present. So if the implant feels firm, painful, deformed, then I would recommend a capsulectomy. If there's a concern about ALCL, then the patient definitely needs a capsulectomy for the capsule tissue to be analyzed. And occasionally, particularly in patients who are considering having their implants removed for breast implant illness, they will ask for the capsule to be removed. And again, we have to have a discussion about what this really means in terms of pros and cons to decide whether we should or should not be performing a capsulectomy. Capsular contracture is divided into 4 grades, big grades. So grade 1 is where you have soft breasts, minimal symptoms. Grade 2 is when they're slightly firm, but not particularly painful. Grade 3 is where they're firmer and deformed. And then grade 4 is when you get hard, painful, distorted breasts, the most sort of significant type of capsulation. Capsulectomies can be performed in a variety of ways, and it partly depends on what we're trying to achieve. So if we're performing a capsulectomy simply because there's hardened tissue, and it's really for symptom relief, then it would be reasonable to perform what's called an anterior capsulectomy. So you remove the capsular tissue that's on the front of the implant. If you're removing all of the capsule tissue, that would be a total capsulectomy. In my practice, the vast majority of the time, I perform an en bloc capsulectomy. And this is where you take out the entire implant with the whole capsule surrounding it as one. So it's an en bloc. And then you take, once it's out of the patient, you then open the capsule to take the implant out. And then if necessary, we would send the capsule off for analysis if there was a concern. A capsulectomy is a safe procedure. I have seen comments online which say that this is a 3-hour or 4-hour operation. I have to say this is completely untrue. And I feel rather upset when I read this kind of misinformation. A capsulectomy should, in somebody who's doing it regularly, should take about an hour to an hour and a half. Can be done as a day case. No drains are needed. Of course, there are risks with this operation, as there are with any, but this involves a detailed discussion with the patient. And I think this is not an operation that somebody whose day job is dealing with burns or with skin cancer than just to be doing a capsulectomy. It's somebody who's routinely doing this operation is likely to give you sort of a safer, better results. All cosmetic procedures are going ahead during the pandemic now, because we have good procedures in place to minimize the risk of operating on patients who might be COVID positive, as well as good procedures in place to minimize exposing patients to COVID through green zones in hospitals, testing of staff, and of course the vaccination. So yeah, cosmetic procedures are taking place. There's always the understanding that if the pandemic takes a turn for the worse, then of course we may have to pause, but at present we're operating as normal. And we have a discussion about the impact of COVID as well as part of our consultation.